Here's your Ask Dr. Rajani question of the day.
Hi, what do you think of the Agnes RF microneedling treatment to reduce spot fat like the jowls and under the chin? It's being promoted as a sister to the Secret RF, and it seems to be a little bit less invasive than the Kybella. I'm especially interested in the jowl area. Thank you.
Excellent question, and interested in the jowl area. Who isn't? Okay, so we mentioned Agnes, which goes in, it's like a probe, goes in and heats and it targets fat, number one. Number two, Secret RF, and that's the RF microneedling. Multiple needles go in and they heat up, and you can change the depth, the heat, the duration of the pulse. Jowling's a big issue for a lot of people. Right off the bat, Agnes and Secret are good products. They're good devices. I want you to think of this. If you take a car is a great device. You can have a great car. You can use it to commute around, and that's great. It serves a purpose. You can also use it for bad purposes, okay? So the car isn't the issue. It's the person driving the car. Here is the same thing. Those are two great devices. I like them. I don't use them in practice. I have used them. I go into many offices that have them. They can be used for good, actually for great, because they work on the jowls, they work on the skin. If you have the wrong person using those devices because they are powerful, it can be a disaster. And particularly you want to use it for the jowls. So in the right hands, it can work. Why don't we just go in and suck the fat out? Because it can damage the nerves. You can do it lightly. You do what we call to mess, and you put lidocaine or water in there. So it gets kind of more soft. It expands the area, and then you can go back and forth and suck it out. This person mentioned Kybella. The problem with Kybella is it can work well, but understand, remember the nerves I talk about? It can affect the myelin. So the covering surrounding the nerve, the electrical impulse to make me smile, the nerve jumps across to little areas where the electricity can go, and there's myelin in between that's like an insulator. And that insulator can be taken away by the Kybella, and it can affect your smile. Now, in the studies, everyone's smile came back, typically 2 to 6 weeks. So Kybella can be used, but you have to be, I guess, ready for that side effect. It's happened to me. I treat people fairly aggressively because people don't want to have surgery. I tell them, hey, you might get that problem with the crooked smile. And there's a nerve that comes underneath, particularly in the jowl area, that we get concerned about, but it will come back. So you have to be, everything has a side effect. Heating is less likely to cause that nerve problem, but it can occur. You can get a neuropraxia. So yes, I like the devices. Find a good provider. Kybella, probably a slightly higher risk of the nerve damage. It always seems to come back, and multiple sessions are needed. Don't think of a one and done. Think of 3. If you get your result after 1, we're all happy. Take your credit and apply it to something else, or use it in a year or 2, because the jowls will likely come back over time, whether it's non-surgical or surgical. Facelifts and non-surgical don't last forever. We age every day. Reduce your aging rate. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.